Your kidneys are among the most hard-working organs in your body, quietly filtering more than 50 gallons of blood every single day. Yet most people don't realize when their kidneys begin to struggle because the early symptoms are often subtle or mistaken for something else. According to the National Kidney Foundation, about 1 in 10 adults worldwide has some level of chronic kidney disease, and millions of people remain undiagnosed until their condition becomes severe. The Mayo Clinic also emphasizes that kidney problems tend to develop slowly over time, showing few or even no warning signs in the beginning. That's why paying attention to early changes in your body is so important. Welcome to Health24, your trusted source for clear on health and wellness. Here, we bring you accurate, evidence-based information to help you understand your body better, all supported by reliable medical sources like the Mayo Clinic, Cleveland Clinic, and the National Kidney Foundation. In this video, we'll explore 10 hidden signs your kidneys might be in trouble, explained from a medical perspective and backed by trusted sources like the Cleveland Clinic and Johns Hopkins Medicine. Our goal is not to alarm you, but to help you stay informed. By understanding these signs early, you can take the right steps to protect your kidney health before it's too late. And remember, this video is for educational purposes only. It's not a substitute for professional medical advice, diagnosis, or treatment. If you experience any of the symptoms we discuss, please consult your doctor or a qualified healthcare provider right away. Now, let's begin with the first hidden sign, one that may appear early, even before you feel any pain or discomfort. The first hidden sign that your kidneys may be in trouble is frequent urination, especially at night. While it's normal to urinate 4 to 8 times a day, needing to go much more often, particularly waking up several times at night, can signal that your kidneys are struggling to filter waste effectively. According to the Mayo Clinic, one of the earliest signs of kidney dysfunction is a change in urination patterns. When the tiny filtering units in your kidneys, called nephrons, become damaged, they lose their ability to concentrate urine. As a result, your body produces more diluted urine, and you may find yourself going to the bathroom more frequently. The Cleveland Clinic adds that frequent urination may also indicate conditions like urinary tract infections, diabetes, or an enlarged prostate. But when combined with other symptoms such as swelling, fatigue, or foamy urine, it becomes a red flag for potential kidney issues. The National Kidney Foundation notes that persistent nighttime urination, called nocturia, is often an early indicator of chronic kidney disease because the kidneys are less efficient at maintaining fluid balance. Here's what to look out for. Waking up more than twice per night to urinate. Producing large amounts of clear or pale urine. Feeling an urgent need to urinate even when your bladder isn't full. If these signs sound familiar, it's worth scheduling a kidney function test, such as a blood creatinine test or urine albumin test, which can help your doctor evaluate how well your kidneys are filtering. Remember, early detection is key. The sooner kidney changes are identified, the easier it is to manage and prevent further damage. The second hidden sign that your kidneys may be in trouble is swelling in your legs, ankles, feet, or even your hands, a condition doctors call edema. When your kidneys are healthy, they work continuously to filter excess sodium, toxins, and fluids from your bloodstream. But when they begin to lose function, the body retains salt and water, leading to noticeable puffiness in your lower limbs and sometimes around your eyes or fingers. According to the Cleveland Clinic, swelling from kidney problems usually begins in the feet and ankles because gravity causes fluid to collect in those areas first. The swelling might start off mild, just a little tightness in your shoes or socks, but over time it can become more pronounced, even leaving an indentation when you press your finger against your skin. The Mayo Clinic warns that this kind of fluid buildup is not just a cosmetic issue. It's a sign that your kidneys aren't maintaining the right balance of electrolytes and fluids in your body. In some cases, it may also indicate worsening kidney disease or heart-related complications. The National Kidney Foundation highlights that swelling often goes hand in hand with other symptoms, like weight gain, shortness of breath, or fatigue, all signs that fluid is accumulating in your tissues and possibly your lungs. What to watch for? Swelling in your ankles, feet, or hands that's worse in the evening. Puffiness around your eyes in the morning. Rings or shoes feeling tighter than usual. Sudden, unexplained weight gain due to water retention. If you notice any of these symptoms, don't ignore them. Persistent swelling should be checked by your doctor. A simple urine albumin test or kidney function blood test, eGFR, can reveal early signs of kidney dysfunction before more serious complications occur. Taking action early, through proper diet, hydration, and medical advice, can help reduce swelling and protect your kidney health in the long run. Hidden sign number 3, fatigue and low energy. The third hidden sign that your kidneys may be in trouble is fatigue and low energy, feeling tired even after a full night's rest. The kidneys do much more than filter waste. They also play a crucial role in producing a hormone called erythropoietin, or EPO, which signals your bone marrow to make red blood cells. These cells carry oxygen throughout your body. When your kidneys are damaged, they produce less EPO. This means fewer red blood cells, resulting in anemia, which can cause constant tiredness, weakness, dizziness, or even shortness of breath. According to the Mayo Clinic, people with chronic kidney disease often experience fatigue because of this reduced oxygen supply to the body's organs and muscles. Even small declines in kidney function can significantly affect energy levels. The Cleveland Clinic adds that this form of fatigue is often gradual. Many patients describe it as feeling drained, sluggish, or mentally foggy, even when they're eating well and getting enough sleep. The National Kidney Foundation also highlights that toxin buildup in the blood due to impaired kidney filtering contributes to fatigue, muscle weakness, and reduced focus. When waste products and excess fluid accumulate, your body simply can't operate at full efficiency. Watch for these signs of kidney-related fatigue. Constant tiredness, even after rest. Shortness of breath or lightheadedness, pale skin or dark under-eye circles, difficulty concentrating or staying alert. If you suspect your fatigue might be kidney-related, a complete blood count, CBC, and kidney function test can help identify whether anemia or toxin buildup is contributing to your symptoms. While occasional tiredness is normal, persistent fatigue, especially when paired with other warning signs, deserves medical attention. Early treatment can help restore your energy and protect your kidney function before serious damage occurs. The fourth hidden sign that your kidneys may be in trouble is foamy or bubbly urine, something many people notice but often ignore. Normally, your urine should appear clear to light yellow, with only mild, short-lived bubbles when it first hits the toilet. However, if your urine looks persistently foamy, like soap suds that don't go away, it could be a warning sign of protein leakage, known medically as proteinuria. Under healthy conditions, your kidneys act as fine filters, keeping valuable proteins like albumin in your bloodstream while removing waste. But when the kidneys' filters, called glomeruli, become damaged, proteins begin to leak into your urine, causing that distinctive foam. According to the Mayo Clinic, foamy urine can be one of the earliest signs of chronic kidney disease, CKD, often appearing long before pain or swelling occurs. The Cleveland Clinic explains that the foam results from excess protein reacting with air when the urine is expelled. The National Kidney Foundation also emphasizes that foamy urine is not always due to hydration or pressure. If it persists for more than a few days or weeks, especially when accompanied by swelling or fatigue, it should be evaluated by a healthcare professional. Here's what to watch for. urine that remains foamy even after flushing. Larger or more frequent bubbles than usual. Additional symptoms like swelling or tiredness. Doctors can confirm protein loss with a simple urine albumin test, sometimes called an albumin to creatinine ratio (ACR) test. This measures how much protein is leaking into your urine, an early sign that your kidneys' filtering units need attention. Tip: foamy urine can also occur temporarily from dehydration, fever, or heavy exercise, but persistent foaming should never be ignored. It's your body's way of signaling that your kidneys might be under stress. Taking this sign seriously and consulting your doctor early can help prevent long-term kidney damage and protect your overall health. The fifth hidden sign that your kidneys may be in trouble is dry, itchy skin, a symptom that's easy to dismiss but can actually indicate a deeper problem inside your body. Your kidneys play a vital role in maintaining the proper balance of minerals and nutrients in your blood, including calcium and phosphorus. When the kidneys start to lose function, these levels can become imbalanced, causing waste to build up in your bloodstream. This buildup irritates the skin and the nerves underneath, leading to persistent dryness and itching. According to the National Kidney Foundation, itchy skin, medically called pruritus, is common in people with chronic kidney disease, CKD, especially in later stages. The Cleveland Clinic notes that this itching often affects the back, arms, legs, or scalp, and tends to worsen at night. It can be mild for some people, but severe and uncomfortable for others. The Mayo Clinic adds that when your kidneys can't remove enough toxins and excess minerals, your skin may also become dry, rough, or flaky, sometimes with small white crystals forming on the surface, a condition known as uremic frost in advanced cases. Here's what to look out for. Persistent or unexplained itching that doesn't improve with lotion. Dry, cracked, or flaky skin, even with good hydration. Itching that's worse at night or spreads over large areas of the body. Skin that feels tight or rough to the touch. It's important to note that dry skin can have many causes: allergies, eczema, or dehydration. But when accompanied by other kidney-related symptoms like swelling, fatigue, or foamy urine, it's a sign worth investigating. What you can do: if you suspect your kidney health might be contributing to skin issues, talk to your doctor about a blood test to check your creatinine, urea, calcium, and phosphorus levels. These tests help identify whether your kidneys are properly balancing minerals in your body. To manage mild itching, stay hydrated, avoid hot showers, use gentle moisturizers, and wear loose cotton clothing. But remember, these are only supportive steps. Persistent itching should always be evaluated medically to rule out underlying kidney disease. As the National Kidney Foundation reminds us, your skin often reflects what's happening inside your body. And in this case, it could be your kidneys, sending you an early warning signal. The sixth hidden sign that your kidneys may be in trouble is puffy or swollen eyes, especially in the morning. While puffiness around the eyes can happen occasionally due to lack of sleep, allergies, or fluid retention, persistent or severe swelling may indicate that your kidneys aren't functioning properly. According to the National Kidney Foundation, protein leakage from damaged kidney filters, proteinuria, can cause fluid to accumulate not only in the legs or ankles, but also in more delicate areas like around the eyes. This happens because proteins help maintain fluid balance in your blood. When protein is lost in the urine, fluid shifts into surrounding tissues, causing noticeable puffiness. The Mayo Clinic explains that puffiness in the eyes can be an early indicator of kidney disease, often appearing before other obvious symptoms like swelling in the feet or hands. Meanwhile, the Cleveland Clinic notes that this sign is frequently overlooked, yet it can be one of the first visual cues that kidney function is compromised. What to watch for: swelling around the eyes in the morning that improves or worsens throughout the day. puffy eyelids that feel tight or leave slight indentations when pressed, swelling combined with other symptoms such as foamy urine or fatigue. If you notice consistent puffiness, your doctor may order a urine albumin test to detect protein leakage or a kidney function panel to assess filtration levels. Early detection is key. Addressing kidney stress at this stage can prevent more severe complications later. Number 7. Blood in urine. The 7th hidden sign that your kidneys may be in trouble is blood in your urine, medically called hematuria. Blood in the urine can appear as pink, red, or cola-colored urine and may be visible to the naked eye or detectable only under a microscope. While sometimes it can result from urinary tract infections, kidney stones, or vigorous exercise, persistent or unexplained blood is a serious warning sign that warrants medical attention. According to the Mayo Clinic, hematuria can indicate damage to the kidneys or urinary tract, often caused by inflammation, infection, or injury to the filtering units known as glomeruli. The National Kidney Foundation emphasizes that even small amounts of blood, if persistent, can be an early indicator of chronic kidney disease, CKD, or other kidney disorders. The Cleveland Clinic notes that blood in the urine can also signal glomerulonephritis, inflammation of the kidney's filtering system, which can impair kidney function over time if left untreated. Key signs to watch for: pink, red, or cola-colored urine, frequent urination or burning sensations during urination, swelling in the legs, ankles, or around the eyes alongside hematuria, fatigue or other unexplained symptoms that accompany the blood in urine. If you notice blood in your urine, it's important to see a healthcare professional promptly. Tests such as urinalysis, urine microscopy, or kidney imaging can help determine the cause and guide early treatment to protect your kidney health. Early recognition of hematuria can make a significant difference in preventing further kidney damage. Don't ignore this sign. Even small amounts of blood in the urine can signal underlying kidney issues that require attention. The 8th hidden sign that your kidneys may be in trouble is high blood pressure, also known as hypertension. Your kidneys play a crucial role in regulating blood pressure by controlling the balance of salt, water, and hormones in your body. When they're damaged or not functioning properly, this balance is disrupted, causing your blood pressure to rise. According to the National Kidney Foundation, chronic kidney disease, CKD, is both a cause and a consequence of high blood pressure. Damaged kidneys can no longer filter excess fluid efficiently, which increases blood volume and pressure. Over time, uncontrolled hypertension can further damage the kidneys, creating a dangerous cycle. The Mayo Clinic explains that high blood pressure often shows no symptoms in the early stages, which is why it's sometimes called the silent killer. It can quietly strain your kidneys, heart, and blood vessels without obvious warning signs. The Cleveland Clinic emphasizes that monitoring your blood pressure regularly is key, especially if you have other kidney-related symptoms such as swelling, fatigue, or changes in urine. Early detection and management of hypertension can slow the progression of kidney disease and protect your cardiovascular health. Lifestyle modifications like reducing salt intake, staying physically active, managing stress, and following your doctor's treatment plan are critical for keeping blood pressure in check. Regular checkups and kidney function tests are essential if hypertension is present alongside other warning signs of kidney disease. High blood pressure may be silent, but it's a powerful indicator that your kidneys need attention, and addressing it early can make a significant difference in long-term kidney health. The 9th hidden sign that your kidneys may be in trouble is a persistent metallic taste in your mouth or ammonia-like breath. This occurs because when your kidneys are not filtering waste efficiently, urea and other nitrogenous compounds accumulate in the bloodstream. Some of these compounds are released through saliva and breath, causing a distinctive metallic or ammonia-like taste. According to the National Kidney Foundation, many patients with early or progressing chronic kidney disease, CKD, report this unusual taste, which can lead to reduced appetite, nausea, and changes in food preferences. The Mayo Clinic explains that this symptom is part of a condition called uremia, which occurs when urea and other waste products reach high levels in the blood. In addition to affecting taste, uremia can contribute to fatigue, nausea, and cognitive changes if left untreated. The Cleveland Clinic notes that patients often describe this metallic taste as persistent and noticeable even after brushing teeth or using mouthwash. It may also be accompanied by bad breath that smells like ammonia, which is directly linked to the body's attempt to excrete excess nitrogen through the lungs. What to watch for: persistent metallic taste in your mouth, ammonia-like odor on your breath, reduced appetite or unexplained nausea, other kidney warning signs such as swelling, fatigue, or changes in urine. If you notice these symptoms, it's important to see your healthcare provider. Simple blood tests measuring BUN, blood urea nitrogen, and creatinine can assess kidney function and detect early dysfunction. Addressing this symptom early, along with other warning signs, can help protect kidney health and prevent progression to more serious complications. The 10th and final hidden sign that your kidneys may be in trouble is persistent nausea, vomiting, or loss of appetite. When your kidneys are unable to filter waste effectively, toxins such as urea and creatinine accumulate in the blood. This buildup, called uremia, affects the digestive system and the brain's appetite-regulating centers, leading to feelings of nausea or an aversion to food. According to the National Kidney Foundation, these gastrointestinal symptoms are often seen in people with chronic kidney disease, CKD, and may appear before more obvious signs such as swelling or changes in urine. The Mayo Clinic explains that uremia can also cause stomach discomfort, a metallic taste in the mouth, and a general sense of fatigue, all of which contribute to a decreased desire to eat. Over time, this can lead to weight loss and malnutrition if not addressed. The Cleveland Clinic notes that when nausea, vomiting, or appetite loss occurs alongside other kidney warning signs, such as swelling, high blood pressure, or foamy urine, it should be evaluated promptly by a healthcare professional. What to watch for: persistent nausea or queasiness, vomiting without an obvious cause, such as food poisoning, reduced appetite or early satiety, unintended weight loss over weeks or months. Early detection is critical. Blood tests like BUN, creatinine, and electrolyte panels, along with urine tests, can help your doctor determine whether kidney dysfunction is causing these digestive symptoms. Addressing kidney health early through medical guidance, lifestyle adjustments, and proper hydration can prevent further complications and improve overall well-being. We've now gone through 10 hidden signs your kidneys may be in trouble, from frequent urination and swelling to fatigue, foamy urine, dry skin, puffy eyes, blood in urine, high blood pressure, metallic taste, and nausea or loss of appetite. These signs are often subtle, easy to overlook, and sometimes mistaken for everyday issues. Yet, paying attention to them early can make a huge difference. According to the National Kidney Foundation, early detection of kidney problems allows for interventions that slow progression, protect kidney function, and improve overall health. The Mayo Clinic emphasizes that regular checkups, including blood pressure monitoring, kidney function tests, BUN and creatinine, and urine tests are crucial, especially if you notice one or more of these warning signs. The Cleveland Clinic adds that combining medical guidance with a healthy lifestyle, balanced diet, proper hydration, and regular exercise supports long-term kidney health. Remember, this video is for educational purposes. It is not a substitute for professional medical advice. If you experience any of these symptoms, please consult your doctor or a qualified healthcare provider. Thank you for watching Health24, your trusted source for clear, evidence-based health information. If you found this video helpful, make sure to like, share, and subscribe so you never miss our latest health tips. Stay aware, take action early, and protect your kidneys because your health is worth it.